So I would like to introduce Dr. Rebecca Doland from Pacific Hearing. She grew up locally here in San Jose. She attended Chico, receiving her Bachelor's of Arts degree in speech pathology and audiology. She received her Master's of Arts degree in audiology from Long Beach, and then her doctorate degree in audiology from the University of Florida. Whoa! She has been with Pacific Hearing Service since 2017 and switched to Director of Audiology with Pacific Hearing Connection, which I think is a fabulous nonprofit, by the way. And I also love Pacific Hearing, as you know. But she switched to the Pacific Hearing Connection in 2021. Please welcome Dr. Rebecca Doland.
Thank you, guys. I'm going to try to share my screen here. Hopefully my technology works. You guys seeing my screen? Give me a thumbs up, somebody? Okay. So thank you guys for having me today. It's so great to be able to be here with other people that are like-minded with hearing and hearing loss. Today I'm going to talk to you about Pacific Hearing Connection, who we are, what we do, and how someone might be able to become a patient of Pacific Hearing Connection. There we go. So I've been an audiologist for over 20 years. I've also been a hearing aid user for over 20 years. So I understand the complications, the difficulties that can arise with hearing aids, with the use of hearing aids. So this is why I love helping people get back to the lives of communication and interaction. I have such a deep respect for Pacific Hearing Connection's dedication to treat each patient as a human being with different needs, different abilities, not just as a consumer with the goal of selling a product. So our nonprofit organization, Pacific Hearing Connection, is run by donations and grants. We help those that are lower income to be able to get hearing health care that they need. So where money is an issue, that's where we come in. We are located in the same office as our for-profit Pacific Hearing Connection in Los Altos. So we're right at the corner of San Antonio and First Street, right behind Foothill Expressway. We're pretty easy to access from almost any freeway. I do think 280 is probably the easiest though. It can take you right to Foothill Expressway and you can easily get here from there. So this is the one slide I will actually read because you just can't improve upon a mission statement. So our mission is to build the self-worth of individuals by restoring their hearing potential and providing them with opportunities to engage with their communities through service to others. So I'm going to reread that last little bit, to engage with their communities through service to others. That last little bit we truly believe in as a nonprofit, and this is how we show that. Part of our program, we have incorporated a circle of giving model. So being that we truly believe in service to others, that's why we've developed this model. It's a chance for patients to continue the give back in their community, kind of a pay it forward. So to get help in the community, or excuse me, to help a community that has helped them. The community has helped them by donating monetarily, hearing aids, or time, just to volunteer for us. So because they've been helped by their community, we ask our patients to give back as part of payment for the hearing aids by volunteering. This is not meant to be a burden. This is not meant to be stressful. This is meant to be something wonderful and beautiful that they can feel good about now that they're hearing better and they can get back into the community and do some hours helping out. Now, let's say someone is not able to do the community hours for mobility reasons or health, anything like that. Someone can do the hours in their honor. So if they have a friend or family member, or actually we just had our community hearing day and the volunteers that helped that day were actually offering to do the hours for some of our patients that we saw, which was a beautiful, beautiful thing. So it's a wonderful program that many of our patients have gone on to continue to work and do the volunteer after they've already completed the hours with Pacific Hearing Connection. A couple people have actually gone on to get jobs at the places they started volunteering. So let's get into some statistics. So hearing loss is a lot more common than most people think. So WHO, the World Health Organization, estimates 360 million people worldwide have significant hearing loss. The major problem with that is that in many countries, including the United States, access to hearing healthcare to obtain hearing aids is expensive and is typically not covered by most insurance plans or government programs. Estimated 37.5 million people in the United States alone have hearing loss, 15% of the population, or 1 in 6 people. So let's look at all the people on Zoom here. So I already said I have hearing loss, so I could be person number 1. If we count through the people in this room, I think there'll probably be a little more skewed for people having hearing loss on here. But if you look in just a general room, you count 5 more people from yourself, likely someone has hearing loss. That's how common it is. And in many cases of low-income adults and children, that hearing loss goes untreated. So let's take it even smaller. In the Bay Area, which is about 6.9 million people, 1.5 million of those people lacked enough resources to meet basic needs, just food, shelter, basic necessities for living. All told, almost 4 in 10, or 36.4% of California state residents were poor or near poor in 2017. So it's pretty easy to identify unhoused with tent cities and at times mentally ill. However, this is also what poverty looks like. In an area where median house prices are $500,000 or more, many workers you meet every day would find it impossible to pay for hearing health care on their own. So in looking at that, we use the Santa Clara County Area Median Index Limit Table. We use this as a sliding scale of measurement to approve patients for our program. Federal also has a sliding scale like this, but it's about here. With the Santa Clara County, because it's more expensive to live here, we get this much. So for example, a 2-person household can make $116,000 a year or less and qualify for our program. So those people who are living on Social Security alone will typically qualify for our program. Many people think it's impossible to provide best practices with a nonprofit situation. We believe not only can it be done, but it must be done. We need to get to know the patient preferences. This evolves as we go on more and see more patients. So there are many hurdles that we must meet. So doing routine testing, comprehensive evaluation and assessment and measurements, that's necessity. That's what we have to do. Our goal is to do the best we can of the circumstances that are in front of us. So hearing aids are only part of the solution. We need to make sure there's proper diagnostic and evaluations to assess your unique situation. Each person is different in what they need to be fit with, what accessories they may need. Everybody's different. Most people complain about understanding in noisy situations, yet most standard evaluations for hearing don't include measurements of performance and noise. We do. Service and maintenance really is more than 10%. And if the hearing aid is not working properly, you won't be able to hear to your best potential. That's why we keep up with service and maintenance. We want to make sure that the hearing aids or any devices that they're using are working at their tip-top capacity. So how can a person become a part of Pacific Hearing Connection? So many people know their income right off the bat. So when it says qualify on this screen, it's really kind of a person knowing, okay, so $116,000 a year or less with a 2-person household. Yeah, I qualify there, or yeah, maybe I don't. So the qualification there kind of goes on in that own person's mind. Then we go to applying. There's 3 ways that people can do that. One is our website, www.pacifichearingconnection.org. That is at the end of the slide, so you don't have to write it down just yet. And you can apply online. 2, you can visit the website, print a copy of the application, and send it into our office. 3, I'm always happy to email or mail an application to someone if they so choose. Once approved, once they send in the application, their financial paperwork, I can typically get someone scheduled within about a week. So there's really not a long wait time in this. It's really just getting application in to getting scheduled. We always ask people to refer family or friends or someone else you may know that says, you know, gosh, I've been told I need hearing aids, but there's no way that I can afford them. We ask people to let them know that we're here. We want to help all we can. And by getting the word out, this will help others to know that we're here. We don't want anything to stand in the way of our patients receiving hearing health care. So if anything is needed, for example, a ride to our office, someone to translate, we're going to help. If hearing aids are not possible for whatever reason, but talking one-on-one with others is still needed, we will find accessories to help meet their needs. If help is needed talking on the phone or hearing the television, we can give options as well. Again, we want to treat the person as a whole, not just a symptom. So with that, I wanted to give everybody a little bit of fun news. We just had our second annual Community Hearing Day this past Saturday. It was held in our Los Altos office, and it was from 9 to 4, and it was by appointment only for those patients who had pre-registered and had appointments. We had 26 volunteers. You can see this picture shows most of our group. We had 4 translators. We had 3 drivers to pick up those patients that could not have gotten here otherwise. We had 7 audiologists. We had 1 student and many people from our community who just wanted to help. We were able to see 18 people. We conducted hearing testing to determine hearing aid candidacy. We removed wax for people that needed it. We were able to fit 29 hearing aids and provided counseling for those who qualified for our program. California Connect, formerly California Telephone Access Program, or CTAP, was also there. And they were able to give amplified phones to those who were interested because they already had a hearing test with us, so they could actually leave with the equipment that day. It was a wonderful, wonderful day. So on this particular day, one day a year, our Community Hearing Days, it's the one day that we omit all of our fees. So for people that come anytime during the year, our services are not free. There is a minimal fee, but we make sure that it is affordable for that person. We don't want anyone to say, oh, well, I still can't afford that, I'm going to have to leave. That doesn't happen. We figure things out. But on our Community Hearing Day, one day a year, all of that is free. The hearing aids, the hearing testing, the wax removal, all of it is no charge to our patients. So it's just a wonderful, wonderful day. It's exhausting, but it's a beautiful moment of feeling exhausted. And that's about it for me. You guys have any questions?
Becky, can you unshare your screen? So we can see
Absolutely.
you? Perfect.
I have a question.
Sally,
Becky, how long has the organization, your nonprofit, been in operation again?
we were founded in 2016 by Jane Baxter and Debbie Clark, the owners of Pacific Hearing Service.
And roughly how many hearing aids are you giving out a year? If you could give me an kind of an idea.
Oh, you're asking me to dig deep now. I do have those statistics, but not in front of me. I want to say it's definitely over 100 every year.
Around how many? I'm sorry.
It's over 100.
Over
every year.
100.
Mhm.
That's awesome.
Elliot, I see your hand is raised.
Yes, Debbie, I remember 5 or 6 years ago, I donated some old hearing aids to your organization. I think I was dealing with Debbie Clark at the time. But my understanding at that point that you were doing some work overseas. Are you still doing work overseas?
Yeah, so what happens there? So Pacific Hearing Connection is our local nonprofit. We work in our community here. With Pacific Hearing Service, we work under a co-op called Entheos. That's a national cooperative. And what happens there is they organize trips to go to Guatemala, to Jordan, to Mozambique. So that's where those go. So some of the hearing aids that are donated to Pacific Hearing Connection will get donated to Entheos to be used overseas.
Now, do you or any of your colleagues attend any of these overseas trips? Or are
Yes.
you primarily focused locally?
I'm primarily focused locally. I have 2 small children, and so I'm not really comfortable leaving for weeks on end going to another country. But Jane and Debbie, Dr. Rachel Appleton, some of our front office staff have gone overseas to go and help.
And how you mentioned at the outset that the recipients of your hearing aid through the Connections Group are expected to give back in some way, shape, or form. Can you give us some examples of the type of work they're doing? And is that an obligation or just something they're asked to do optionally?
Yeah. So we can't force anybody to do it. So it's something that we ask. It is part of our program. So we do really encourage it. I have really not ever gotten any pushback on the volunteer. The hours right now are 8, and it's over 2-month span of time. So it does not have to be done consecutively. If someone's already volunteering, let's say at their church or at their kid's school or somewhere else with a food bank, they can keep going. That's great. Kind of sky's the limit with volunteering. People this weekend kind of got excited about the idea of, oh, you have information about Community Services Agency and Mountain View, and they always need volunteers. People can volunteer at libraries. People can volunteer at, some animal shelters that need help. So there's really no limit. They're welcome to help with us at our events. I do have a couple patients that have done that. But that's not necessarily, it doesn't have to be with us. It could be wherever they so choose.
So would you say all your recipients or the vast majority of them do some sort of volunteer work?
Yes.
No, that's a good program. Thank you.
Two things. First of all, where's the best place to donate hearing aids for if we have extra ones and we want to donate? And the second one is I sent Jane and Debbie a whole list of places to volunteer. So I think if any of you can think of any place that they could volunteer, it would be probably you'd probably like to have more on.
I would love that. Yes.
So if you guys know of any and want to send them to her, I think she'd be happy to have more.
I would love that. If you want to donate hearing aids to Pacific Hearing Connection, you can bring them to the office. We have an office, like I said, in Los Altos. We also have one in Menlo Park on Alameda de las Pulgas next to the Goose. So you can drop them off at either office. You can get a donation receipt that you can use for a tax write-off if you so choose. Just have to let them know. You can also mail it here, and then we can also mail you a donation receipt. Janie?
Is there a specific kind of hearing aid that you do not take? Like maybe the in the ear, or do you take anything?
We're really trying to stick with the RICs, the ones that go behind the ear, because we can adjust those and refurbish them and, put brand new receivers on them. So we try to stay more with those. We have found a place that will refurbish in the ear hearing aids for a new person. I haven't used them yet. I haven't needed to. But I only keep a small few of the in the ears, and I think I really have enough of those right now.
Okay. And what about, one more question, what about all the over-the-counter hearing aid that are starting to come in? Will you be taking those if people don't use them?
Probably not, only because I don't have the software to program them. So I can't really do much with them. So it's kind of like Miracle Ears we don't take because I can't do anything with them. So any proprietary device, Costco devices, Miracle Ear, Eargo, those we can't do anything with, unfortunately. I wish we could, but we can't.
Thank you.
Steve, do you have a question?
Yes, thank you. I have 2 or 3, if you don't mind. The first one is, you mentioned a co-op for sending hearing aids for worldwide distribution. What was the name of that again?
Entheos, Enthos.
OS. Okay.
It's
And
audio.
would you send the Miracle Ear hearing aids to them or the in the
No.
ear?
It works the same way as us because Miracle Ear and those are proprietary. You can only get the software if you're in that place. So with us or anybody else, we can't get that software to do anything with them.
Well, that's good
So
to
we're kind
know.
of stuck.
Because I thought every some of these places take any, but some are not usable also.
Yeah.
And then about proving that somebody qualifies, how do you do that? That's question 2.
Yeah. So the best way to do it is the tax return. However, there are some people that don't make enough, so they don't do taxes. So in that case, we ask for their proof of Social Security income or any income that they have. Maybe it's disability, and 60 days worth of bank statements. We have to have this legally if we ever get audited to say that, yes, we are seeing the people that we're supposed to be seeing. So it's not shared with anybody. It doesn't go anywhere. But that's how we have to qualify people legally.
So that creates a task for you guys to do that. Do you?
Yeah.
I guess, and that's all part of your, I guess, volunteerism. I'm a little overloaded to be able to do that. So then the other 2 more questions maybe. How do you market your program? Community. I'm calling it community awareness. How do you?
So we have a director of outreach. Her name is Barbara Beck. She goes to libraries, low-income housing, community centers, really any place, and talks about us. We're getting into physicians' offices as well to let them know, just in case they find a low-income person, that we're here. The word is really starting to get out. We are definitely well past our pre-pandemic numbers. When COVID hit, everything kind of shut right down. So we're doing really great already this year. So with Barbara's help, because it was kind of just me and our director of programs kind of trying to do all this, but with Barbara's help, the word is now kind of going like wildfire, which is awesome.
Yeah, I feel your pain. I don't know if I should have introduced myself. I'm with HLAA, Chester County, Westchester, PA, Pennsylvania, all the way over
Hello.
there.
All the way over there.
And our program's called Help for Hearing, and we've been we launched some soft launch, let's call it, last April. We haven't quite finished the launch because we're working on website and whatever. We've processed at least around 200 hearing aids for recirculation. Now, we're not doing the qualifying or dispensing them. We don't have an audiologist on board. That's one of our, hopefully, our goals someday, to be able to say there's a person in Chester County that can take care of that part of it.
Yeah.
But, we usually donate to Hearing Charities of America. Is a nice organization for using them for people that need. And we've had 2 projects, one to Honduras and one to Argentina. So both of those, we've donated some hearing aids from the refurbished. They're not refurbished, they're just donated. And actually, I started making sure they all work. So
that's important.
And I have to add, I'm really surprised. And 95% of what's donated, they do work. I mean, they need to be, as fitted and the right adjustments and all that. They can't just be put in. But in the same sense, some can. Then the only other program, I don't know what the other question was. So you're the audiologist that we need, but you have to move to Chester County.
That's a big move.
I think my co-founder and vice president, I think he might have written you and asked, because you'll see the email at some point, if you know any audiologists through your network that are in Pennsylvania that maybe would work with a program like this. That's our biggest struggle.
Yeah, it's hard to find it.
And there's a young lady in New Jersey that runs New Jersey Hearing Aid Project, and she's actually just a freshman in college. She started a nonprofit in high school,
I
and
love it.
she's wonderful. She's very similar, but she has Montclair State University processing the refurbishing and dispensing them and doing it all. So she's a very good resource for
That
collecting.
sounds like a remarkable person.
Yes, she is. I've gotten to know her on the internet anyway, on eBay, email.
Yeah.
Yeah, thank you.
Yeah. Larry, did you have a question? I saw your hand up.
Yes, in terms of items we can donate, would you take assisted listening devices too, like neck loops and things that I've accumulated over 25
They're
or
just sitting in
30
a box?
years?
Absolutely. Yeah, because that's where, some people just need maybe a telecoil neck loop in order to connect with their phone. We have pocket talkers that have been donated, and for some people who are hospital bound that, maybe have severe dementia, they really can't handle something in their ears. They can at least have a pocket talker, something over their ears with a microphone. They can hear the doctor, they can hear their family, they can have some communication. It's not as ideal as hearing aids, but it's better than just sitting in silence. Kate, I see Kate's hand up. You're muted, just so you know. You're
Kate,
muted,
you
Kate.
need-
We can't hear you. You want to type it in? If you can type it in, I'll read the question.
Kate is muted.
There it is.
There's-
I couldn't, I'm on my cell phone, so I
Oh.
couldn't find that thing. Anyway, so thank you for Becky. We've met a couple times and you bailed me out. So bail me out one more time. The group here has a scholarship committee, and we've been pretty good in handing out scholarships. Our biggest challenge is getting the kids, finding the kids, because the hearing, non-hearing or poorly hearing population is small, and the population that's high school age is smaller. Graduating seniors yet smaller, looking for a scholarship. We're getting really tiny here.
Yeah.
And we've managed usually to get about 3 a year. So if when you do your intake, you see any kids, there is a scholarship out there, and we're always looking. It's pretty much year round, even though the kids have to do their graduation and their prom before they can think about a scholarship. And our deadline's April 15th, so it's coming up. But we're always looking. The requirement is that they live in San Mateo County or go to school in San Mateo County, and that they fill out a very simple and easy application.
And you said the deadline is April 16th?
15, like a tax return.
Okay.
30 some odd years of doing taxes. Yep, that date sticks.
That's the day. Okay,
Yeah,
I will definitely keep that on my radar if I hear of anybody. We see more people from Santa Clara County just because we're in Los Altos, but because we also, have Pacific Hearing Service in Menlo Park, we do see some from the
San
San
Mateo.
Mateo County. So I will definitely keep my eyes and ears out for that.
Okay, great. If you can let your comrades know.
I will.
Because some
definitely.
of their clientele are younger.
Yeah,
Okay, thank you.
absolutely.
Kate, could I just ask this? I know sometimes people have applied a little late. Can you address that?
If they tell us about it, we're very accommodating, but we're not looking for somebody to apply at the last minute. We'd like them to kind of follow some of the guidelines. But if they have something, we had one year somebody who had struggles just getting the paperwork to show up and to come through. And sometimes there's a document they still have to get, and that's all fine. We're fine with that. We're very flexible, but we don't want to advertise it too much.
Yeah.
And remember that this is every year, Dr. Dolan. So
Yeah.
tell Jane, she can contact me because I'm on the scholarship committee if she wants it. Every year we have this scholarship, and sometimes, what does it take? Sometimes like 9,000, or how much is it? Elliot, how much is it?
Elliot, yes,
Right.
Elliot, speak
Well,
up for us.
it varies from year to year, but I think over the last, I think it's 2017 when we started, I think we have awarded about 15 scholarships, and the average was about around $3,000 each.
That's fantastic.
Mhm.
Yeah, can someone, I just put my email on our website too in the chat. If someone could email me a link to that scholarship application, and I will forward that to everybody at Pacific Hearing Service.
Wow, thank you.
Yeah.
Yeah,
We'll get
that's
it done.
great. Kate would be happy to do that. And I'm on the
Thank you.
committee too, so we're all
Thank you.
of all the help you can give us.
Becky, that information is in the newsletter, which will be coming out in the next week or so,
Okay.
that Pacific Hearing gives us and donates their time and energies to let us have that hearing aid published.
Awesome.
So you'll have that in that. You can take a look right there as well.
Okay.
Thank you.
I missed something, Becky, about, is this limited to certain counties, or I'm not sure, I missed it.
No, so I mean, for certain grants that we get, we have to have so many people from a county, one county or another. But this past weekend, we saw someone from Reading, we saw someone from Sacramento. So if they can get here and they qualify, I'll help them.
So this is for California residents, I take it, right?
They have to be in California when they're seen. Yeah.
Okay.
Steve, your hand went up again. Where'd you go? Oh, you're muted. You're muted, Steve.
Yep, that's me again, and I was muted. Thank you for letting me ask one question, and I'll say one other statement. First of all, the scholarship, we also give out a scholarship every year to a high school senior. We work with the CCI, we call it here, the intermediate unit. I don't know if you have that in your counties, but any child that has a hearing loss that needs assistance in the school system, they go through the CCIU, and so we know who they are, and they take care of finding the students to apply and nudging them a little. We have the same thing with the deadline. Ours is April 1st, but we don't give out the scholarship till June, so we can be a little flexible, and one teacher helped a student last year, and it was a wonderful, perfect. So it ended up that they won the scholarship because they were really the person that should get it. Just as far as you said, you take assisted listening. I call it ALD devices. And I have quite a few, and I might send them off to you if you're interested. And
That'd be great.
I know from experience that the Roger pens have fallen off. People are not using them, and they're putting them away, and so they're donating them. And here's a brand new one in the box, never used, Roger pen that I don't know, must have been at least $600-800. I have a streamer for clear sounds, and I have a Phonak MyLink. And I've been holding these because I felt like I didn't want to just send them to what I call the clearinghouse. But I'll think of you when I get ALDs, and we'll maybe pass on some to you, because I'm still not sure what happens to them when you send them to these other places. So thank you.
Go ahead, Steve, when you have a chance, email me. Let's kind of keep in contact, because I might be able to help you out too in Pennsylvania. There might be a nonprofit through Entheos. Each person that's a part of the cooperative of Entheos has a nonprofit for their backyard called Hearing the Call. So I know there's.
We have a Hearing the Call. Yeah, we work with. Can you hear me?
Yeah.
We work with a Hearing the Call locally, and not in this county, but close enough.
Yeah,
Yeah, so yes, we're connected.
okay, perfect.
Thank you.
Elliot,
Yeah, Becky, one more question occurred to me. Let's say out of the 100 or so devices that you issue a year, or 100 or so people that you help, how many of those are assisted with recycled hearing aids that people have donated versus hearing aids that are new from a manufacturer? Number one. Number two, can you get cooperation from certain manufacturers to donate the equipment so you're not out of pocket for it?
yeah. So that's part of the great thing. This past weekend, all the hearing aids that were fit on our patients were new. They were older technology, but they were brand new that manufacturers donated to us for this purpose. So a majority of patients are fit with refurbished devices. They can get new, but the price changes a little bit because then we have to order them. Sometimes the manufacturers, I can't really get a specific device, but they're so good about, donating receivers, and if they have an excess of older devices, just passing them on. So they've been so wonderful to us. It's helped us. So there's a mixture of both.
Yeah. Do you have certain manufacturers you like to work with, or maybe you're not at liberty to say, but
You know what? I'll work with anybody that I can get some good devices that I can program, and I'll work with anything. So I'm okay.
you can program anything.
I can program anything.
Becky, I
Yes.
know sometimes people will give hearing aids to one of us in HLAA saying, I don't know if they work, they were my mother's or they were somebody else's. Are you willing to accept hearing aids that we don't know if they're working or not that have been donated to one of us?
Yeah, because we do electroacoustic analysis on them. So we don't just, assume like if we can hear them and they're working, we check them objectively to make sure that they're not weak, they're not distorted, the directional microphones are working. So there's a whole process that we do in order to make sure that they are functional and ready to go.
Great.
I think Janie. You're muted.
Sorry, do you have like a small flyer or something that I can add to our hearing newsletter for the chapter? Because then other people could know that they can donate the hearing aid to you. Or
Yeah, let me
listening
see
device.
if I can come up with something. I'll probably give this job to our outreach, our
Okay.
director of outreach. So you just want something about like kind of who we are and if they want to donate and what to
Be
donate?
like a little half page or whatever, like, yeah. Because that would help get the word out.
Okay. Got it.
Okay. Thank you. Any more questions? I don't see any. Oh,
Kate?
Kate?
Yeah, what's your email so I can send you all this good stuff?
So I put it in the chat. Can you get to the chat? If not, I'll tell you really slowly. It's long.
Yeah, tell me slowly.
So it's contact, CONTACT at Pacific Hearing Connection.
I'm writing as fast as I can.
That's okay. I know it's a long one.
.org?
.org.
Got it. And how do I make it specific to you?
It all comes to me. I'm the only one
Oh,
that does the email.
you're
So it's
it.
me. It's me.
So it's contact at pacifichearingconnection.org.
That's it.
Great. Thank you.
Yeah, absolutely. You guys have some good questions. This was fun.
That's good.
I'd like to just share something. Quite a few years ago, probably almost 20, maybe 18, one of our physicians in our church was going to China to do cochlear implants on some children and teach doctors there. And we started taking teams over to work with kids that were hearing impaired as well. And our church, one day I just decided to see if I could go to the congregation and ask for used hearing aids. And over that course of several years, people donated 120 hearing aids that we took that had to be refurbished, some of them, but they were working, and we were able to give them to young children there in China. So it's just an idea to think about for outreach, that oftentimes churches might be an opportunity to ask people to donate used hearing aids, as we did, and can be and would be a great resource. Something to think about, Becky.
Yeah, thank you. Oh, I see
one more.
one more hand, Steve. You're muted, Steve.
I just have to say one other thing just to help you out a little bit. I have a gentleman who's co-founder of this program here, and he's really a great advocate. And one of the things we've done is we met with the Department of Aging for Chester County, and Zoom meeting, talked for a half an hour, and they agreed to send our flyer out. And in the end, they sent it to 400 locations in the
Wow.
county. Now, our county's about 500,000. It's not huge in comparison to some of California, but it's enough people that it went out to basically every senior whatever, and anything they had to do with. And then it blossomed. As you know, word of mouth. Well, then these other people wrote us and said, well, we're going to send it to our contacts. So it's amazing how much you can do just on the internet, or
Yeah.
so.
Yeah, it's the new age of technology.